Chapter 10. Managing Infectious Disease. There are many types of infectious disease. Viruses are usually mild infections, but sometimes can be more serious. And of course, bacteria are treated with antibiotics. There's a brief description of each type here, as well as in the textbook. There are different ways that diseases can be spread or transmitted. The most direct way is just person to person. Two people shake hands or hug each other. That direct contact. Indirect contact could be from contaminated objects, and this is most common in early childhood because if children have contaminated hands, then they touch many things in the classroom, and that disease can be spread that way. The disease can be spread through droplets from sneezes, through the air from sneezes or coughs, and also through blood. Bloodborne transmission is, however, very uncommon in early childhood and school settings. If teachers and school personnel follow standard precautions, then there shouldn't be any bloodborne transmissions. And we will talk about the standard precautions here later in this chapter. Here are some of the common symptoms of disease. If a child has a fever, typically they have flushed cheeks as well. So if you think that a child may be ill, of course you can take their temperature to find out if they do have a fever. If the child has a new cough, that would be something that you'd want to investigate further as well. And if they vomit with no other explanation, then that could be something that would be a symptom of a disease also. The incubation period for different diseases varies by quite a bit. So this is the time between the child being infected and the time when the symptoms actually occur. And this could be hours, days, or even weeks or longer. If you're interested in common incubation periods, there's a table on page 331. It's table 10.1, and it lists childhood infections, modes of transmission, as well as incubation periods and symptoms. So that's a pretty useful chart to have for teachers. The incubation period for strep throat is as little as just a few hours, and then one of the longer incubation periods is 160 days for hepatitis B. So you can see the wide range in incubation periods there. Some of the symptoms of common infections are diarrhea, respiratory illness, and skin infections and rash. And diarrhea is often caused by viruses, whereas respiratory illness is usually spread by sneezing and coughing. Symptoms of respiratory illness include fever, congestion, runny nose, and cough. And then skin infections and rashes are caused a number of different ways. They can be caused by bacteria, viruses, or fungus. And children, if they have rashes, may need to be excluded, but it depends on the cause of the rash. Frequent hand washing can minimize the spread of many common infections. So it is really important that teachers and children practice the proper hand washing procedures throughout the day. Of course, we talked a little bit about children's immunizations and which ones are required for childcare and for school. And these immunizations are the most effective method for the prevention of children's infections. So it's great that we have these immunizations, and they're preventing a lot of diseases that used to be much more common. In addition to children's health records and immunizations, there should be health assessments for teachers also. So we should be looking at the health history and immunization records of teachers, and they should be having vision and hearing screenings as well. And of course, if teachers are ill, they should stay home too. It's important for teachers to take care of their own health and be current on their immunizations, but also stay home if they're sick to recover from the illness themselves and also to prevent spreading it to the children in their care. One of my favorite professors used to say to me, "Take care of yourself so you can take care of the children." And that's a very good rule to live by. Ways to control the spread of disease, of course, one of the most effective is to just ensure that proper hand washing by all teachers and children. So depending on the age of the children, they can learn to wash their own hands given the needed supports. So sometimes there are posters or visuals hung up by the sink. Of course, the teacher can assist young children in washing their hands as well. Some of the times when hands should be washed are pretty obvious: before eating meals and snacks or handling food, and of course after using the restroom or touching animals, but there's a lot of other times when children and adults should be washing their hands as well. And the textbook lists a number of these on page 335 and 336. In an early childhood classroom, another one is, of course, when children engage in water or sensory play, they'll want to wash their hands after doing that. In addition to assisting children with washing their hands, teachers should take the time to teach children how to effectively wash their hands. They should use disposable paper towels to also prevent the spread of disease, and they should be using those disposable paper towels to turn off the faucet if the water doesn't come on automatically. You don't know when children are infected with a disease necessarily, especially if they're still in the incubation period and they're not showing symptoms yet. So it's important to use standard precautions whenever dealing with bodily fluids or blood, because those can cause infection. So teachers should use disposable gloves whenever they're helping to care for a child that might have blood, like a scraped knee or a bloody nose, whatever it might be. It's very important to have those disposable gloves handy and be prepared for injuries, because those will happen. Of course, the other standard precaution that's very important is sanitizing and cleaning surfaces to prevent contamination. In order to help prevent the spread of disease at the time and in the future, it's important to teach young children how to take care of themselves and to practice preventative health practices. So we talked about the importance of teaching young children how to wash their hands. You can also teach them how to cover their cough and blow their nose, when it's important to stay home if they're sick, and those types of things. There are lots of good children's books that teach these habits, as well as songs and other mediums too. One of my favorite children's books that talks about the spread of germs is called Germs Are Not for Sharing, and it's part of a whole set of those books. It includes Hands Are Not for Hitting, Feet Are Not for Kicking, and so on. So that's a good one. If you don't know of it, you can check that out. A good way to help children learn about the spread of germs. The child care center or school that you will work at should have a policy on when children need to be excluded from school or child care because of illness. If a child happens to become ill or injured at school, you need to have a plan for where that child will rest until a parent or caregiver can pick them up. So, of course, they need to be supervised the entire time. So it could be in the classroom itself, but away from other children. In a public school setting where I used to work, the child would typically wait in the nurse's office, and she would have a place for the child to rest. But you should be sure that there's a pad and blanket to make the child comfortable while they're waiting. Families should be notified at the beginning of the year or when the child enrolls in the child care center of any policies of exclusion due to illness, so that they know the possibility of that happening before the incident. In some cases, you'll want to notify other families of an illness and let them know to be on alert. Things like pink eye or lice in the classroom. If you notify families of what to look for, that can be helpful in eliminating the spread of disease as well. There's a list here of diseases that are preventable by vaccine. So with any luck, you won't encounter a lot of these diseases, but they have decreased in prevalence. But it's important to know the signs and symptoms of these diseases just in case you do happen to have a child with one of these diseases in your classroom. For many of these diseases listed here, the child should be excluded for a time, either until they get treatment or until the medical professional says it's safe for them to come back to school. Most of these you've probably heard of. Whooping cough is a very bad cough. Chickenpox is much less common now. I actually had a very bad case of chickenpox when I was younger, so I looked it up, and it was added to the immunization schedule in 1995. So again, the prevalence of that has dropped quite a bit since then. Measles is also very contagious, and children should be excluded if they have signs or symptoms that they have measles. And I do encourage you to just read over the description of these diseases and their symptoms in the textbook so that you are somewhat familiar with them. There's a list here of some other common childhood diseases. Of course, the common cold. My daughter is 18 months old, and she started going to childcare about a year ago, and she's had numerous colds since then, as she is, again, just her first year in childcare and being exposed to all the other children. She's gotten a lot of mild infectious diseases. Once a child has been in a group setting for a while, then the rate of those illnesses should decrease. Pink eye is another common one. I had a few outbreaks of this when I taught preschool, and I actually ended up getting pink eye as well. And it's not very serious, but children should be excluded if they have pink eye until it is treated, just so it doesn't spread. It can be scary for young children because their eyes can get stuck shut due to the discharge. So that can be kind of scary when they wake up and are unable to open their eyes. Croup has a distinctive cough. Strep infections are very common as well as ear infections, but ear infections are actually not contagious, so children don't need to be excluded for that. Fifth disease and pinworms are again explained in the textbook, but they come along with a rash. And RSV is typically not real serious, but it does have symptoms of fever, runny nose, and wheezing. For infants, it can cause breathing difficulties and can be more serious and require hospitalization. For exclusion guidelines, they are listed in your textbook. It's table 10.2 on page 347. So that can help you to know which diseases children need to be excluded for and for what amount of time. There's listed here some infections and other illnesses involving the skin. So I'm sure you all are aware of head lice, which again is not a real serious thing, but it does spread easily. But head lice do not spread disease. So that is the good news about head lice. And usually once children are treated for head lice, then they can return and it will not spread any further. One of the biggest considerations when I taught preschool and there was a lice outbreak in my classroom was that I had to wash any stuffed animals, any clothing, anything of that nature that could have lice in it as well in hot water to make sure that we stopped the spread of lice as much as possible. I actually do have some experience with hand, foot, and mouth disease now since I've had my daughter. She got hand, foot, and mouth disease probably from her childcare center, and it was a real mild case of hand, foot, and mouth. So it was very mild and it lasted just a few days, and then usually once they get the rash, they're no longer contagious, but it does spread very easily. So this is usually pretty mild. It can be more serious if a child refuses to eat due to sores in their throat and their mouth that makes eating difficult. A friend of mine, actually, her son, she had to take him to the ER because he wouldn't eat due to hand, foot, and mouth disease and the sores in his mouth and throat. And once she got him there, they ended up giving him a popsicle and just some stronger pain medication to help, and he was able to go home then. I actually got hand, foot, and mouth disease when my daughter had it, and I got it a much worse case of it. And it does say that it's non-itchy, but I know when I had hand, foot, and mouth, it was very itchy and very uncomfortable, and I actually went to the doctor and got a steroid cream to help with the itch and the symptoms. There are some serious bloodborne infections, which again are serious but are not common in early childhood programs. So hepatitis B, hepatitis C, and HIV are very uncommon, but again it's very important to follow the standard precautions so that if you have a child in your care who has a bloodborne infection, it's not spread. So the risk of transmission is low also, but because of the seriousness of these diseases, again teachers should always wear gloves and use those standard precautions, make sure everything is sanitized properly so that these diseases are not transmitted. In a lot of cases, especially with HIV, the family decides whether to inform the school or not. So there is a chance you would have a child in your care that has HIV and you might not even know it, which I'm not sure if that's a good thing or not. I was thinking about that. Obviously, it is their choice. But again, if you follow those standard precautions, then you'll be safe even if a child is infected. Of course, if you have a child with HIV and you are aware of it, then one of the concerns is to protect the child with HIV because they're more susceptible to infections also. These are some diseases that are common among children who are entering the United States who are not born here. If that's the case, if they are coming to the United States and they were not born here, they should be screened for these diseases upon arrival.